Dr. Ghatan, you are a dermatologist, and that basically means you're, a skin doctor and do all kinds of things with the skin, making skins look pretty, the face more firm and all that. So what about skin rashes? Dry skin, itchy skin. Where does that come from? How does it can get handled, and what are the effects of it? Is it dangerous? Something which we need to fix, otherwise we get even more sick? Tell us about it.
Sure. Well, if you remember, skin is a very vital organ, and the main function of being a barrier, a protection, a wall against infection. So if the skin barrier is broken, then we are more prone to get infections. So when we get dry skin, and if it gets very dry and get cracks in the skin, then the bacteria which is on everybody's skin has a better chance of entering and causing infection. Also, we'll be more prone to get viral infections such as warts. I think it's an epidemic in America that people overwash and overuse and abuse soap. Soap really is meant to clean dirt. It's not, some people misunderstand that, and they have dry skin, they think that soap is going to help them. They use soap. No, soap is meant to just clean and wash away dirt, and it's not a treatment for dry skin. It makes it worse. It's best to minimize use of soap, especially in the winter when it's cold and dry. Because that's going to make it much worse. For example, myself, in the winter, I don't use soap on my thighs because my thighs get very dry. So I don't use it. Maybe once a week I use that. It's important to lubricate the skin to help it, to get rid of dryness and scaliness, and it's not only aesthetically looking better, but it's also healthier, and you feel better if your skin is intact. If you don't have.
How should we lubricate it? What are some of the creams, some lotions we should use, or which are some of the ones we should stay away from, where we think they're good but they're not?
Well, there are a number of factors to consider. First of all, different creams work differently and are meant for different parts of the body. There are lotions that can be used, creams can be used for the face. And I usually tell patients, look, there are a bunch of creams. I give you the names and, if I have samples, I give you the samples. You try them out. You see what agrees with you. You can use that. I do caution people who have acne, for example, that using a moisturizer is going to clog up your pores and is going to make your acne worse. So you need to get a moisturizer that doesn't do that. And we've been able to identify a couple of moisturizers that are ideal for people with acne, and we make it available through our office for that purpose. People tend to have dry hands, cracked, dried hands, and especially people in the medical profession, doctors, nurses, dentists, who tend to wash hands so many times a day, they're very prone to get this kind of problems. We have a special protective moisturizers that we can suggest to them to help prevent the problem. And for the body, there are so many other moisturizers that can be used. It's just a matter of using it, and trying it out and see what agrees with you. I do tell people that, especially people who have eczema, that if you take a shower, you don't rub the towel hard on your skin. Just tap dry, and then right afterwards you can use some moisturizer. It works much better. There's going to be better absorption, and you get a better result with it.
Okay. Good. So basically keep the skin moisture with lotions. Try which one agrees with you, and don't wash so often.
Right.
All right. Yeah, I'm very sure that, because, we all think that if we don't shower down 3 times a day, we're not doing our job, but apparently it's not necessarily true. So let me ask you, since you mentioned the word not wash so often also, so what about, the 1 hour soaking in a bathtub with whatever salt waters and with whatever type of thing, good thing, not so good thing for the skin?
No, there are times that we do suggest to soak the body in water, and we have medication that we add to the water to help the skin. For example, for psoriasis, we have a special oils that can be added to the water, and we advise the patient to soak in there for 15-20 minutes at night. Again, washing too much is not ideal, but there are times that soaking would be beneficial.
Right. And let me ask you, is in terms of soap, most people, and you see it advertised on television, they use very strong soaps with strong deodorizers in it, and then there are the soaps, whatever the ivory soap or whatever the name brand is, which are rather natural, and there are many other ones out there. And frankly, because I use most of those ones, you need to wash and scrub a little more often, otherwise you still might possibly be smell afterwards. So the real heavy deodorants work better for that purpose of, so to say, getting sprinkly clean or whatever they call it. But do they are they more daunting on the skin? Are they drying the skin more than the more natural ones? Do you have any data on that?
Yeah, sure they do. They do, and for that reason we advise patients to stay away from those and use soaps that are much less irritating and softer on the skin.
So basically it's this. Yes, you might get rid of your dirt and you're smelling a little faster with some heavy chemical soaps, true, but you're ruining your skin in the long run.
That's right.
Well, all right, here you have it. Thank you very much, Dr. Ghatan.